Before we get started and I introduce our panelists, I wanted to take just a moment and review where we have been in Adams County and what some of the subjects that we have covered in the past Commissioners' Community Forums since we took office in 2012. I recall we started out in East Berlin, our very first one in the library. Our topic was economic development. I think we moved then to Little South on water quality, Orangesville agritourism, Buchanan Valley clean green, York Springs broadband, Conawaga, our 911 radio project, Conawaga, our emergency services, Gettysburg, we had a forum at the middle school on the 150th, which was pending. The New Oxford, our planning department, had a program on their economic development survey, and in Fairfield, Gettysburg, and New Oxford, at the end of each year, we host a State of the County presentation, which incidentally we will continue this year. This evening, we are here to discuss and provide information regarding mental health services in Adams County. Adams County is in a mental health joiner with York County, called the York Adams Mental Health Intellectual Disability Drug and Alcohol Program. Well, for short, we call it MHIDD, and that short name actually involves a whole lot of human service programs and an overall budget for Adams County of about $3 million, which is a combination of county, state, and federal funding. I know that many of our residents, including myself prior to taking this position, do not understand or comprehend the importance of many of these programs in our community. That is understandable unless you are a client in need of these services, have a family member who requires these services, or you are involved with agencies or organizations such as law enforcement, courts, prison, and social service agencies. I know after spending 30 years in law enforcement myself, it was surprising how frequently I came in contact with individuals with mental health issues. It is unfortunate that while driving here this evening, you cannot help but think about how frequently, even in the last 3 days with the Oregon shooting, the question of mental health services, identification, and treatment comes up. When after each tragic shooting or incident, we ask the question of appropriate identification, classification, and treatment, and say to ourselves, what if? In speaking to some of our staff prior to this evening, I believe some of the concerns you may hear verbalized tonight are making the most out of limited mental health resources through collaboration with community agencies, proper training and education for law enforcement and correctional personnel within the county, concern for public safety, limited group home availability to the mentally ill being released into the community from the justice system, lack of insurance or medical assistance as a barrier to getting individuals who are in the criminal justice system into services to connect those in need with services that are available. At this time, I'd like to just recognize and introduce our presenters for this evening. Our first presenter will be Steve Warren, our York Adams Mental Health and Intellectual Disabilities Program Director. And I asked Steve just how long he had been doing this, and the answer was for 32 years. Now, we deal with Steve frequently, and I can't say enough good things about Steve and his knowledge and his direction of mental health services in York and Adams County. We have Michelle Hovis, who is the Choice Programs Director for approximately 15 years. She'll be presenting tonight as well. We have Jay Arnerzak from the Adams County Criminal Justice Advisory Board in the 4 Adams County Courts here this evening with us. And we have Daniel Reck, the Director of Probation Services. And then, not on your agenda, we have Neil Burkholder, our Director of Court Operations, who graciously came this evening. And we have Shauna Wagner, our District Attorney, who's also come this evening. So I'm sure all these folks will be able to provide some information and resources to us tonight. So just to go over a few housekeeping issues, we're going to have each presenter come up to the podium and give their presentation. When they're done, they will entertain a few questions, if you have them, from the audience. And then at the end, if we have time, we'll take more questions. In order to, again, respect everyone's time in our host facility, and they have folks here, we will try to begin and end on time. So, do my colleagues have any comments before we introduce our first presenter?
The only thing I want to bring up in brief, about 6 months ago, Joanne Smith, who is the president of the Department of Adams County, received Volunteer of the Year Award. And during our remarks, congratulating her, one of the questions I had for the audience was to show how common mental health diagnoses are in American Adams County. I asked people to raise their hand if they had a family member with a mental health diagnosis, and a handful of people did. And I asked anyone, do you have any friends, or do you have any neighbors that you know have a mental health diagnosis? Anyone you work with? By the end of 2 questions, everybody's hand was raised. So when we say this issue is of immense importance in Adams County, you really can't understate that. But you also can't understate how often people don't want to talk about this. That there are other issues in county government or just in the community that we do want to talk about. Because a lot of things we don't. We want to keep behind closed doors. We want to sweep some things under the rug. Our hope tonight was, let's shed a little more light on mental health services in Adams County by bringing in some of the experts who know. As Randy has said, it's a pretty steep learning curve when you walk into the courthouse, and this part of your budget, you have to continually be educated on not just the funding side, but the number of services that are out there, the number of agencies, and the complexity of the funding. So thank you all for coming out. It's always nice to have a couple dozen people show up for one of these things. And it's great that we're going to be from tonight so we can work with the media and more people can learn about this issue.
And also, I'd like to say thank you for coming tonight, and thank you to Brother Holmes for sponsoring this activity. And I am not a mental health expert. I'm not. Been advancements made because of crisis intervention training, where before conflict may have ended up in that individual being arrested, but through crisis intervention training, the situation was diffused. It did not escalate to the point where the person had to be taken in for processing. So I know processes can work, and we're here tonight to say that we have a consensus that we want to do a better job in the area of mental health. And part of that is educating people as to what is happening, what is available. Because we know treating mental health is very important to family members because it's quite a burden on families to have someone in the family with great mental health conditions. They reach out for help, and it's great to know that that help is available. So, again, thank you for coming tonight.
Thank you. I beg to differ with Commissioner Martin. He could be deemed an expert. He has to deal with Commissioner Pauly on a daily basis. So,
That's what you call on the job training.
one thing I would like to do before I bring Steve Warren up, I'd like to introduce a few of our staff members. In the back, actually, our Chief Clerk, Paula Nyman, is largely responsible for helping to put this together tonight. So thank you, Paula. Our County Manager, Al Penska, is sitting in the back. And actually, our Veterans Affairs Director, Stan Park, is also back there. And some of you may know that with our veterans, both homelessness and mental illness can be a proponent of many of our veterans. So we appreciate them coming tonight. So at this time, we're going to move to the front row, and I'd like to introduce to you Director Steve Warren.
Good evening, ladies and gentlemen, and I would also like to thank everyone for taking time out of their schedule this evening and coming learn a little bit more about services that are available to individuals and families who reside in Adams County. As Commissioner indicated, I've been doing this job for 32 years now, so I can probably say that I've seen it all and done it all, but there's always new challenges that our program is faced with, and so each and every day we strive to improve services, expand services, and myself and our staff are committed to the citizens in Adams County in terms of providing mental health services. What I'd like to do tonight is go through a PowerPoint for you, and basically there are two major components within the PowerPoint. First few slides, I'm going to identify the services that are available in the community, the different types of services. And then secondly, I'm going to talk about eligibility and access to those services. And I'm going to get very specific in terms of who individuals can contact to try to access what you're going to hear tonight. Okay. So as been indicated, we are what's referred to as a joiner program. Just give you a real brief history of our program. We go back to 1966 when the Joint County program was formed. Prior to the early 1960s, services for people with mental illness in the community were very, very limited. Basically, families had the choice of one of two things. They either kept their family member home and under shelter, or they institutionalized them in large state-operated institutions. In the early 1960s, under President Kennedy's administration, federal laws were passed developing the community-based mental health services. In order to be eligible for federal funding that was made available through these federal initiatives, the states were required to develop laws and regulations that would then determine how this money would be allocated. In Pennsylvania in 1966, the Mental Health Procedures Act, the Mental Retardation Act was passed. Basically what this act did was establish a partnership between state government and county government. It basically required all the counties to establish a local county mental health and mental retardation program and appoint an administrator. Because some counties were smaller than others, the law also allowed for the formation of what we refer to as joiner programs. So way back in 1966, York and Adams County commissioners got together and developed the joiner program. As the administrator, I have 6 bosses, the York County commissioners and the Adams County commissioners. They meet on a regular basis in public meetings where we go over everything from service needs, expansion programs, budget requests, you name it. So I can assure you that the 3 county commissioners here today are very well versed and very knowledgeable about the various services and how they are funded. Commissioner referred to the different funding streams of state, federal, and local funding, county funding. The majority of our funding is state and federal dollars. There are some services that we provide that require what's referred to as a county match. So that would be a 10% county match. So between York and Adams County, they provide our program with that county match. That's approximately $1 million between the 2 counties. It's broken down between York and Adams based on population. But then our overall budget, we don't allocate, okay, we're going to give Adams County X number of dollars and York County Y number of dollars. The joiner program operates with the money that comes in from the state and federal government, and we provide as many services as we possibly can to both counties based on needs. So with that, we'll go to the first slide. I'm just going to give you a brief description of the various services that we provide funding for. We have case management, and I'm going to get a little more detailed in case management as we go along, because basically case management is the gateway to getting all the other mental health services you're going to hear tonight. Crisis intervention, That's a service that provides 24/7, 7-day-a-week crisis intervention for individuals who are experiencing a mental health crisis situation. It can be anything from suicidal ideations to severe depression. And again, I'll talk a little bit more later on in my presentation about crisis intervention, who provides it and how you can access it, and some of the things that crisis intervention does. Inpatient would be psychiatric inpatient care. This would be acute psychiatric care for individuals who need several days in an inpatient facility. The major inpatient unit that we utilize in our area is the York Hospital Psychiatric Unit. Although we use a number of them throughout the state, there are some in Harrisburg that we access. I should point out that Gettysburg Hospital does not have a psychiatric unit. And Hanover Hospital had one for a number of years, but no longer has one. But we will send people as needed as far east as Philadelphia or as far west as Pittsburgh, depending on bed availability. The long-term inpatient service that is provided, we have access to two different types of facilities. One is the state-operated facility, which is Warnersville State Hospital. We have 47 beds at Warnersville State Hospital. So if there's an Adams County resident that needs a longer-term inpatient stay, they would go to Warnersville State Hospital. We also operate an extended acute care facility, which is located in York, and that's a 16-bed facility. Michelle Hobbs from Health Choices will tell you a little bit more about what that program is all about, but it does provide a longer inpatient stay than one of the acute hospitals. Day treatment is also referred to as partial hospitalization. At Adams County, there is one partial hospitalization program run by True North Wellness. It's actually located in Hanover. And this is a program where an individual will go during the day and receive group therapy, social rehabilitation services, and individual therapy, as well as psychiatric coverage by a psychiatrist. The reason we call it day treatment is, unlike inpatient, where they're in the hospital 24 hours a day, 7 days a week, these individuals go home at the end of the day. Outpatient is one of our big services. We have a number of agencies who we contract with located in Adams County that provide outpatient services. They would include things like individual therapy, group therapy, family therapy, psychiatric services, psychological evaluations, medication management. Family support, these are a variety of different support services for families who have an individual family member, whether they're an adult, a child, or adolescent, living at home, who are suffering from a mental illness, and the family needs some support. Or the individual themselves needs support to be as independent as possible in the community. An example of our family support services is our representative payee program. The Mental Health Association of York and Adams County runs the representative payee program, and we have adults with serious mental illness who receive benefits, social supplemental security income benefits. Rather than the check go to them, and they have difficulty managing those dollars, it goes to the Mental Health Association, and then they will, as the representative payee, and they'll work with the individual and their family to make sure that their bills are paid, their rent is paid, and that they have spending money. Help support them in the community. We have a number of different rehabilitation services for people with serious mental illness. We have vocational training programs. Our major provider in Adams County is actually right down the street, which is the Heart Center here in New Oxford. here in the community for people with serious mental illness. Our major ones are our group home programs. True North Wellness operates several different levels of group homes. Most of them are in the Hanover area, although there are some individualized apartments scattered in Adams County. There's also a housing support program that the Health Choices program oversees, and again, Michelle will speak to that. And our newest effort is located south of Gettysburg, and we are in the process of building a brand new facility that's called Specialized Care Residence. It'll be an 8-bed facility that'll be licensed as a personal care boarding home. The provider is Keystone Human Services. And this home, it will provide permanent housing for individuals with serious mental illness. It'll be staffed 24 hours a day, 7 days a week. There'll be psychiatric coverage. We have 2 of those programs now. Both of them are located in York. They've been very successful programs, also operated by Keystone Human Services. We're hoping that that project can be up and running sometime this winter. And in the housing support services, we have a lot of individuals who are able to maintain their own apartment, but they need other support to go with that. And so we have a number of apartment programs where the person resides there, and there are housing staff who meet with them, make sure that their bills are paid, make sure there's food in the refrigerator, we'll take them to appointments, grocery shopping, whatever the case might be. And so that's available likewise. Just want to briefly talk about some of the mental health services that are specific to children and adolescents. Again, we have case management, and I'll talk a little bit more about that in a few slides from now. We also have what we refer to as student assistance programs. Every school district in Adams County has a student assistance program. And it's a collaborative effort between the education system, the mental health system, and the drug and alcohol system. What we provide to the student assistance program is a mental health professional and a drug and alcohol professional who are trained and have expertise in assessing and identifying students who are at risk of some type of mental health problem, whether it's depression, or whether a person has a drug and alcohol, student has a drug or alcohol problem. The way the student assistance program operates is every district has, within the high school and the middle school, what's referred to as a student assistance program core team. That core team is made up of trained staff within the district. It includes teachers, guidance counselors, coaches, nurses, school administration, principals, and they meet on a regular basis as a team, and referrals are made to this team. Sitting on that team with the school personnel are our professionals. So if a parent is concerned that their child may have a drug or alcohol problem, they can make a referral to the core team. If a teacher observes a student, maybe their grades are going down, or they're showing up in class and they're not paying attention, and maybe they were a good student in the past, that teacher can contact the core team and say, I have a student here that seems to be something going on. With approval of the parent, our staff person will meet with the student and do a screening and an assessment, and then come back to the team with a recommendation. So it's a preventive type of service to identify at-risk students within the school. And I might also add that, again, knowing that I've been around so long, the first student assistance program in York and Adams County was at Gettysburg School District. And I worked with Phil Monteith at the time, was overseeing their counseling services then, and we set that up at that district, and then a couple years later it exploded in all the other districts. We also have outpatient for children, day treatment, inpatient for children and adolescents is a difficult service to provide because there are very few inpatient psychiatric units in Pennsylvania. The closest ones for us would be up at the Meadows or at Philhaven. So we at times have sent children and adolescents to those facilities, but we've also had to send them to the Philadelphia and Pittsburgh area. Crisis intervention, of course, is available for children and adolescents. You'll see 3: residential treatment, family-based mental health services, and behavioral health rehabilitation services. Why they are asterisks is that they are funded through the Health Choices Behavioral Health Medical Assistance Program. And that's Michelle's area of expertise. And she's going to give you more information on what those services are all about, as well as all the other behavioral health services that are available to individuals who have medical assistance. Paying for these different services, there are a number of them that there is no cost to the family or the consumer. There are others that do require some payment. So there are, for example, mental health outpatient services. There are 3 ways in which outpatient services are paid for. Number one is that the family or the individual has health insurance that provides coverage for mental health services. Number two is that the person is eligible for medical assistance. A number of years ago in Pennsylvania, the state moved into a managed care environment for not only behavioral health services, but for physical health care services. So Adams County has a wide range of services available to those individuals who have medical assistance. Again, Michelle will touch on all of those. I think by my last look, there were over 8,000 people in Adams County that were medical assistance recipients. Those individuals then would have that MA could purchase, could be used as their insurance for a number of behavioral health services. Okay, now that you've heard a little bit about what services we have, how do you access them? The referral process, where do we get our referrals from? We get them from families, schools, the clergy, the criminal justice system. Your commissioner's talking about the link with the criminal justice system. District attorney's here today. He knows very, very knowledgeable about the various services that are out into the community that individuals and families that he works with that need those. So we connect with his office, the probation department, Burkholder, his staff, try to get those individuals linked as quickly as possible to getting treatment service. Other social service agencies, we work very closely with other county departments. One of our sister agencies is the county's Children and Youth Services. We work very closely with their caseworkers. A lot of children who go through that system have their own issues. The families have mental health issues. That's one of the reasons why they wind up being in the child welfare system. So we work very closely with that agency. Also, the County Area Agency on Aging. A number of our consumers service are elderly and need services that would be available to them as senior citizens. Self-referrals, we just get a lot of people to pick up the phone and call us. Physicians, hospitals, and the community at large. We do have some eligibility that I want to talk about. In terms of mental health services, the majority of the services that we provide, again, are state and federally funded, so they have their own criteria that we have to follow in order to provide the service. And that is that the person has a primary mental health diagnosis as determined through a psychiatric evaluation. The Axis 1 under the DSM, which is the Diagnostic Statistical Manual. Get a little technical here, but basically it's the universal manual that the psychiatric community uses in giving people their diagnoses. So there's various axes that are set up. The first axis, Axis 1, would be, for example, somebody has schizophrenia. That would show up as Axis 1 or bipolar disorder. So we would be looking at that in terms of eligibility for example, one of the group homes or some of the other services. Now, when I talk about outpatient services, anybody can access outpatient services. It doesn't have to be someone with that serious and persistent mental illness. It can be a husband and wife here in Adams County. They're having marital problems and they feel that they need to go get some counseling. They can go to one of the outpatient providers. They may have insurance, they'll pay for it. They may have medical assistance, or if they don't have any other coverage, then they would access our funding through the county MHIDD program. While I'm not here tonight to talk about the intellectual disability side of the program, I do want to give you just what the eligibility is for that. Again, at one time we were considered the York Adams Mental Health Mental Retardation Program. A few years ago we changed that to, rather than mental retardation, to intellectual and developmental disabilities. The intellectual disability would be what was the former mental retardation. So, to be eligible for intellectual disability services, the individual would have to be at a functioning level 2 standard deviations below normal intelligence, which basically is an IQ of below 70. That IQ below 70 has to have been established prior to the individual's 22nd birthday. Just again, briefly, the developmental disability side of our name refers to a program that we operate, which is referred to as early intervention. A lot of people don't know MHIDD is also responsible for infants from birth to age 3 who are born with some type of developmental disability. And that doesn't have to be a mental disability. We have infants who have physical disabilities. We have infants who are premature birth and and are delayed developmentally. We have infants who have hearing problems, speech problems. Up until their 3rd birthday, we have a variety of different specialized providers who will work with those infants and their families. Okay, I want to talk a little bit about case management services, because that's the key to accessing all these different things that I've been talking about. On my staff, I have over 100 individuals who are referred to as case managers. And we have a variety of different types of case management. But basically, regardless of the type of case management, which I will explain, one of the major things that's done through case management is consumers are intaked into the system. And I might mention at this point, notice that I keep referring to the term consumers. When I first started working in the system, which is like in the mid-70s, they were our clients. And eventually, they referred to now as consumers, because they are consumers. They're consumers of the services we're getting. Just like when I leave here and go get my supper at McDonald's or wherever, I'm one of their consumers. I'm getting service from them. So we think it's a dignified way of communicating with the families and the individuals who we work with. So at intake, we will do an evaluation to determine whether they meet that diagnostic eligibility. Oftentimes, the person will come already with it might be a referral where we can get a psychological evaluation or psychiatric that has the diagnosis. We also would do the financial assessment liability, financial liability assessment. Again, as I said before, there are some services that the individual has to contribute to. So outpatient for one, if the person doesn't have insurance, doesn't have medical assistance, and wants the county program to be paying for their treatment, we would look at their income as it is, and then based on a state formula, come up with a dollar amount that they may have to pay. So somebody may go and get 5 hours of therapy in a month. Maybe their bill is $400. They have a liability of $20. They would have to pay the $20. Our program would pay the difference. That's determined at intake also. We would also refer the person for benefits. Reference medical assistance several times. You're going to hear a lot more about the types of services that they provide. Somebody may come in and they didn't even know they were eligible for medical assistance. Our case management folks will help them to apply for and get medical assistance, which opens up a wide variety of both physical and mental health services for them. We also refer to appropriate services, and we would then refer through the intake to a case manager. So after the intake, person who is eligible then would be assigned a case manager. And then we also, again, I mentioned before, coordinate with other human service agencies. We have specialized case managers that work directly with probation officers. So while the probation officer is fulfilling the obligations of the court, we're working to get the person mental health services. Same with children and youth service. While the children and youth worker may be trying to keep the family together, keep the child at home, we're providing support to the child and the family. It could be family-based mental health services, other types of services. I can't go backwards, but I wanted to point out in the slide, our current case management office that serves all of Adams County is actually located in Hanover. It's at 261 North Franklin Street in Hanover. The phone number is area code 717-632-8040. You'll also be hearing some more in the coming days and months about the development of a human service building in Adams County. It's my commitment to that building to relocate a portion of those case managers that are now in the Hanover office over into that new building in Adams County so that it centralizes that particular service. The different types of case management we have, mental health administration, mental health resource coordination, intensive mental health, intellectual disability supports coordination, and then the early intervention. So depending on the individual's assessed need and their diagnosis, that would determine which type of case management they would get. I'll just give you one example. Intensive mental health case management. It's intensive for a reason. Our caseloads are kept very small, roughly 15 to 20 individuals. We have children's intensive case management. We have adult intensive case management. An adult who's on the intensive case management caseload has a serious and persistent mental illness. Most of the adults either are diagnosed with schizophrenia, major mood disorders, bipolar disorder. They've been resistant to getting mental health treatment. They've had frequent hospitalizations, and that's why we keep the caseload low so that intensive case manager can build a very strong working relationship with the individual and their family, making sure that they are going to get treatment, going to our different programs, and staying as stable and independent in the community as possible. In the event that the person regresses and winds up having to be hospitalized, the ICM will stay in contact with them and visit them while they're in the hospital, so there's that continuity. And this is just some of the responsibilities of a case manager. I won't go down each of them, but it's, again, they intake the person into the system, they identify what the service needs are, they work with the consumer and their family and where they want to get their service, what types of service they want, and then they will help them access it. And then once they're getting the service, the case manager will monitor how things are going and be a real resource to the individual. So while you may have a family member who is getting services from 3 or 4 different agencies in Adams County, you may have somebody that's going to the Heart Center, living in a group home, run by True North, and going to Pennsylvania Counseling Services for therapy. So there are a lot of different agencies involved. They will have that one case manager that they can contact to say, hey, I need some help with whatever that might be. Yeah. Designed for adults with serious mental illness. We also have children with emotional disturbances. We're looking for the diagnosis. We focus on our children who are involved in 3 or more public programs. That would be MH, MR, MHIDD, children and youth, the intermediate unit. We also have children and adolescents who are coming back from out-of-home placements, whether it's a children and youth placement, a mental health placement, or a JPO. My last slide is crisis intervention. Spend a little bit of time on that and then turn things over to Michelle to give you the health choices overview. Crisis intervention is available 24 hours a day, 7 days a week. In York, it's provided by WellSpan Behavioral Health, and in Adams County, it's provided by True North Wellness Services. Although I will point out that the Gettysburg Hospital, which is operated by WellSpan, does provide crisis intervention, their crisis intervention staff in the emergency room at the Gettysburg Hospital. There are 3 types of crisis intervention that are provided. One is the telephone crisis. Essentially, somebody needs to speak with a crisis worker they can call. In Adams County, 632-4900, and on the other end of the phone will be a crisis intervention worker. They can talk through whatever issues they're dealing with. They may say, do you want to come in and speak with me? Whatever the case might be. We also have walk-in. Again, somebody can go to the emergency room at Gettysburg Hospital and Wellspan would have a crisis worker there, or at True North, they have walk-in capability at their location in Hanover and Gettysburg. And then also the last is mobile crisis intervention, where True North will actually send a crisis worker out on site to do an assessment and possibly do some type of intervention. Our case managers take mobile crisis workers out sometimes. Mobile workers go to schools. They oftentimes will accompany police when there's a mental health issue that's presenting itself. The other thing that crisis intervention does is that when somebody in the county is in a mental health crisis situation that they become a danger to themselves or somebody else, crisis intervention is the mechanism that we use to facilitate potential involuntary mental health commitments. In Pennsylvania, the commitment laws under the Mental Health Procedures Act allow for a person to be detained for up to 120 hours on an involuntary basis when it is observed that their behavior is a dangerous behavior. That's categorized in one of 4 categories: suicidal, self-injurious behavior, injurious behavior to somebody else, or inability to care for oneself, where it can be projected that within 30 days they can suffer serious debilitating injury or death. Under that act, a family member or somebody who's witnessing this behavior of a family member can contact crisis intervention and request to fill out an emergency petition to have that family member brought into the hospital for evaluation. Once that petition is completed, under the law, as the county administrator, I'm authorized to review that petition, and based on the information and what's the criteria under the law, I'm authorized to issue a warrant that will allow the police to bring the person into the hospital, where they will then be seen by a physician who will determine whether they need to be hospitalized or whether they don't need to be hospitalized at that point. If in fact they are hospitalized under this law, they can be kept for up to 120 hours. That's where our community inpatient facilities are utilized. So again, crisis intervention is how families and individuals access that. Police officers can actually if they see someone who they believe is a danger to themselves or other, they can pick that person up and take them in through crisis and have the evaluation done. So those are the 2 different ways. That concludes my presentation. I'm going to open it up to any questions you may have and then introduce Michelle Hobbs, who's going to talk about the health choices. Okay.
How much of the mental health issues probably are due to people with drug addictions or something?
We see a significant number of issues like that. We call those situations co-occurring disorders. Co-occurring is that a person has a mental health issue, but at the same time has a substance abuse problem. So we do have some programs that are designed to treat those particular issues. Our outpatient providers are able to do that. We also have the Substance Abuse Treatment Center, which is located in York, but was partially funded by Adams County. So it's accessible to Adams County residents. And they have a dual diagnosed license, meaning that somebody who has that co-occurring disorder can go there and receive inpatient treatment. But it's very prevalent in our system. Yes, sir.
Yes, in the new mental health human services building that's been, would you be seeing patients there? Would that be a venue for doing some of the?
Yeah, some of the things that we're considering are, in addition to having our case management staff there, we would be considering having drug and alcohol assessment capabilities there, where individuals can come in literally on a walk-in basis, and there would be drug and alcohol assessors that could do the initial evaluation and make treatment recommendations to them. We are also giving consideration to setting up an office that could perhaps provide telepsychiatry. That's a relatively new type of service. Again, Michelle, through Health Choices, initiated that, where the bottom line is there's a dearth of psychiatric time available, not just in Adams County, but really throughout the state of Pennsylvania, with the exception of the large metropolitan areas. And so the newest modality is to actually have the psychiatric evaluation done via teleconference. Basically, you have a psychiatrist who may be in Philadelphia or Pittsburgh or wherever, he's on the other end, and then in the office is the individual, and there would be a licensed clinician there with them to help with some of the interpretation that's going on back and forth. So we're looking at this building as being an ideal place to have that set up. And then also keep in mind that there will be children and youth services in the building and probation in the building. So as I mentioned before in my presentation, we work very closely with those two different organizations. This would only enhance our ability to meet with families at one location with the children and youth worker, their probation officer, our mental health worker. Yes, sir.
Thanks, that was a very informative presentation. It sounded like you were saying that services are all over Adams and York County, but these managers are centralized in downtown Hanover.
That's where their office is. But one thing I want to point out, and hopefully this might answer your question, I'll try to. Our case managers are very mobile. We have productivity standards that we hold our case managers to, which is 75%. What that means is our expectation is 75% of their time is going to be spent with their consumers. So they're out in the field all the time. Early intervention, for example, all the services are provided in the child's natural environment. So if I have an infant who is 2 years old and has some sort of developmental delay, and I live in Ortana, our providers and our case manager are going to go to Ortana and provide that service right in their home. So they're very mobile.
That is my question.
Yeah.
In reference to youth versus group homes, with group homes, I think there's always, many times they concern the neighbors and neighborhoods about group homes and risk and security. Can you speak to the level of supervision?
Yes, I
in a
can.
group home, and speak to, I know in the south end of the county, the group home you referred to, there's some concern by residents. Can you speak to that?
I sure can, definitely. The particular program that we're going to be opening in the southern part of Adams County, it should be stated here that one of the main reasons that we're opening that up and opening up where we are was that over the years, we have had in different meetings like this and our own public meetings that we have an outcry from family members. We need more residential services in Adams County. And so this was one of our goals was to set up a program like this in Adams County. As I said before, we operate through a provider, Keystone Human Services, two other programs. One is both are located in York. They are 8-bed facilities. They're licensed as personal care boarding homes. They're staffed by mental health professionals 24 hours a day, 7 days a week. There's always staff there. There's a psychiatric nurse that's assigned to the program. So they're there a lot. The person is on appropriate medications. There's psychiatrists that oversees the care of the individuals there. The majority of these individuals who are in these homes suffer from a serious mental illness. But once they are on their medication, they're stabilized, they do extremely well. The two programs in New York have been open for a number of years now, and they've been very successful. Family members are very, very pleased and happy with the service that their family members got. Incidents are very minimal within the home. Usually it's the same type of incidents that other families have within their own family structure. So this notion that there's going to be dangerous individuals living in these homes that can go out independently and not be supervised is erroneous information. And I would also add that these are individuals who are already out in the community in Adams County. And this is an opportunity. So these are folks with serious and persistent mental illness that already live in your community. This program will afford them a structured, supervised arrangement so that they can improve and get on their road to mental health recovery. Yes, ma'am. Hi, Ron. How you doing?
Bipolar, developed leukemia on the medication of a DC med center that had no medication, no follow-up, and we couldn't recall numerous places. And afterwards, that they don't know to get into it. So ultimately, I think that.
Can I ask you, does your family member, you said it's your daughter?
No, it's administered for time.
Oh, okay. I'm sorry. Do you know whether the individual has a case manager with our program?
Yes, I do think so. I'm not sure
Okay. Okay. Because again, WellSpan is providing a specific service, which is outpatient service. So in terms of what they would do once they discharge the person, their level of what they're going to provide stops at that time. That's where you need a case manager to link the person up with other services. So I would highly recommend that you be in touch with our case manager or the individual's case manager and talk to them about what other types of service your person you're representing can benefit from. Yes?
I have a microphone here.
When you send someone down, say to Hanover, who needs services, they're getting their emergency service there, and they got transportation here, and the ambulance is taking them, I'm sure. But when they need more treatment, who's taking them out? Where's their transportation coming from?
Well, that's certainly an issue in Adams County that is outside of my jurisdiction. I know that we provide some funding to Rapid Transit to provide transportation services, but those are primarily transporting people to and from the Heart Center and Life Skills Unlimited. There is a medical assistance transportation program that Michelle might be able to talk a little bit about, but clearly transportation in a rural county like Adams is a challenge, has been a challenge for all the years that I've been around. So I notice it's 7:30, and I know we have to be out of here by 8, and I really want Michelle to have an opportunity to talk to you about the Health Choices program, because so much of the mental health services now are funded through medical assistance. And it's a major change for the good that has affected all citizens in Pennsylvania, and certainly in Adams County. So I will hang around if anybody has any other questions. You can corner me. But at this point, I'd like to introduce Michelle Hobbs, who is the Human Services Director for York County, but also has overseen both York and Adams County's Health Choices program for about 15 years. So, Michelle? And sir, do you want to, can you back it up one? I can.
Clicker only goes forward.
All right,
I'm already technology challenged, but I'll try to stay away from that. Well, good evening. It's a pleasure to be here tonight, and I just wanted to share a little bit of information with you along with Steve. Steve has done a really nice job giving you an overview of mental health services, so I'm going to try not to duplicate a whole lot of what he's already talked about. But I'd say a lot of people don't really understand the Health Choices program, which is really a program that it covers individuals, most individuals that have the medical assistance benefit. And the York Adams Health Choices Management Unit is the other county department that actually covers behavioral health services. And this program actually covers drug and alcohol and mental health services that are funded through medical assistance. As I said to you, the county department that manages this program is the York Adams Health Choices Management Unit. We're actually a very small department of about 6 people, but we actually oversee probably the largest number of dollars, at least in New York County. The Health Choices program is a rather large program, but a lot of the people that work on behalf of the Health Choices program are employed by our managed care company for the county, which is Community Care Behavioral Health. So the county actually has a contractual relationship with them to deliver the services as our managed care company for Adams County. Eligibility for the Health Choices benefit is actually determined by the County Assistance Office. So the County Assistance Office lets our department know who in any given day is eligible for medical assistance. And as Steve mentioned, there are quite a number of people, actually we're up to about 13,000 people in Adams County that receive medical assistance and would be eligible to receive some sort of benefit under the Health Choices program. One of the things I also want to mention, the Health Choices program is very much a benefit for individuals, and we would want to encourage anyone that might be eligible to get under the Health Choices program, because unlike Steve's department, which is dollar limited, the Health Choices program is a required service. So anybody that is eligible to receive a service can be funded through the Health Choices program. So when we have the option to get somebody on medical assistance, we would always want to do that. We do work though very collaboratively with the York Adams MHIDD program because while we will find a lot of services for citizens through the Health Choices program, there are some services that you will recall seeing when Steve had his slide that the Health Choices program does not cover. One of those big ones is housing. Steve alluded a lot to group homes and some of the services they provide. So in some cases, an individual may receive some of their benefits through the Health Choices program, but get some of those other services through the York Adams MHIDD program. So not to belabor what Steve's already talked about here, I just want to mention a couple services just to clarify. Case management. Steve talked a lot about case management. And actually the medical assistance benefit actually covers case management services for individuals that have a need for mental health case management. So ironically, the York Adams MHIDD program is a provider that we fund through the Health Choices program. But I also want to mention that through mental health, there is also another department, another provider that does that called Service Access and Management. So you may run into at times another case manager managing mental health called SAM, a SAM worker. They're doing the same thing as that mental health case manager through the MHIDD program. Peer support is another one of those services that is funded through medical assistance that is a little bit, have a little bit more ability than the MHIDD program to fund. And that is somebody with a serious and persistent mental illness and has lived that experience, actually is able to provide support to individuals with a serious and persistent mental health diagnosis. I also want to mention the last one on here, which is assertive community treatment, also known as the ACT team. This is one of those evidence-based programs that is available to individuals that have very intensive needs. The typical person that gets referred to this type of program is an individual with some sort of psychotic disorder that may have been in and out of the hospital quite a lot and had some difficulty being stabilized over time. So really what I've done here is try to list these services from least restrictive to most restrictive. So case management being sort of that service that it could be available to a lot of people, but the ACT team very selective to very few people, but it could be available to somebody that has some pretty significant needs in the community. I know we're not really talking too much about drug and alcohol this evening, but I did want to mention that part of the benefit package for individuals that have health choices benefit would be access to drug and alcohol services. And I've listed the different types of drug and alcohol services somebody could be eligible for. Normally, in determining eligibility for any of these services, we typically use the PCPC or the ASAM as the criteria. Somebody goes in and gets a drug and alcohol assessment, and that will determine what level of care an individual may be eligible for through drug and alcohol. Children and adolescents. Probably most individuals that are receiving some sort of behavioral health service are probably being funded through the Health Choices program. One of the benefits to having medical assistance is really there's a very rich benefit for children in terms of the types of services that are available to individuals that may need some sort of mental health intervention. We talked a little bit already about case management, crisis intervention, outpatient, and partial, but Steve alluded earlier to behavioral health rehab services. And this is a series of individuals that could be available or services that could be available, which include mobile therapy, it includes a behavioral specialist, consultant, or therapeutic staff support. And these are individuals that are able to go to the person's school, in the person's home, in the community to meet the needs of that individual. And very frequently what we see are anywhere from clinically 2 to 10 hours a week of clinical interventions that are available to that family, and the TSS services could be available. Sometimes we see prescriptions of up to 40 hours a week of one-to-one support that may be available for a child with significant behavioral health needs. The other two I want to mention, and really that one should read multi-systemic therapy and functional family therapy. I just want to mention those because those are two evidence-based programs that we fund through the Health Choices program. They're somewhat newer, but they're somewhat prescriptive in how they're delivered. But certainly in all of our systems, we are moving more to evidence-based services. We feel that they give us better outcomes, and they have outcomes that are actually tracked more effectively than some of the other services that we provide. So you may hear something about multi-systemic therapy or functional family therapy, and if you need some additional information on that, I'd be more than happy to provide that to you. And then I just listed the drug and alcohol services that would be available to children and adolescents on medical systems as well. And then determining eligibility for services. This really speaks a little bit to we have a need, now what do I do? And so just to, I would say one of the easiest levels of care to access is outpatient services. Our managed care company really does not micromanage outpatient. The only real requirement to receive an outpatient service is ultimately to have some sort of diagnosis for a mental health diagnosis, which, you know, there's a whole range of diagnoses individuals can have. So certainly, we would encourage anybody that needs crisis intervention or outpatient therapy to receive that. After that, as the continuum goes up a little bit higher and services get a little bit more intensive, our managed care company does apply medical necessity criteria to each of those other services that were on that list. And really what that criteria outlines is the types of symptoms that we would be looking for an individual to receive that level of care. And in some cases, like in BHRS or family-based, there may be a required psychological evaluation that happens first before that child may be eligible for services. But again, the review by the managed care company will be looking more more intensively at criteria to determine eligibility. And then in terms of as I mentioned, our drug and alcohol services, the ASAM or the PCPC criteria in Pennsylvania is what we use to determine what level of drug and alcohol service an individual may be eligible to receive. Also want to mention that at any time under the Health Choices rules, if anybody feels that they have been denied a service that they should be receiving, we do have a rather extensive grievance and appeal process that individuals can utilize, and we would certainly encourage anybody who's dissatisfied or feels like they're not getting a service they should to actually utilize that process. And then I just wanted to mention in terms of, again, how do people access our system? Because I think that becomes really confusing sometimes. A lot of times people are aware of services and they just don't know where to go as that first step. And so, you know, I would say these are typically entry points for individuals that need behavioral health services. If somebody feels that they are in an immediate need and need to speak to someone and can't wait, crisis intervention, as Steve said, is always available 24/7 to individuals. There are 3 different types of crisis intervention that may be available, and we would certainly encourage anybody that has an immediate need to contact crisis intervention. We also would encourage anybody to seek services through an outpatient provider. Again, that's kind of a first entry for individuals. You know, typically who funds your outpatient provider really depends on your coverage. So if you have private insurance, normally you would go through your private insurance to determine who would be in your network that you could see. If you have medical assistance, you could access the community website or community care customer service line if you need help accessing a provider. Or if you're covered by the NHIDD program because you're uninsured, you would be able to utilize one of the providers within their network. As Steve also mentioned, we are a big proponent of case management services. So if there is a family member or anybody that is having a complicated situation or multiple issues that an individual just doesn't know what to do, where to go, how to get help, we would certainly encourage that referral to case management. And again, if the individual has the medical assistance benefit, they could go to either the NHIDD program or they could be referred to service access and management for that service. And then finally, community care behavioral health as the managed care company for individuals with medical assistance is always available with their customer service line to provide information on providers, or if individuals are having a difficult time finding a provider who's able to see you timely, they can certainly assist with that process as well. And then the last thing I just want to mention is that the Affordable Care Act certainly expanded coverage for individuals that were previously uninsured. We are actually coming up on open enrollment here November 1st, so I would encourage you or anybody that you know that does not have any insurance benefit, they could actually explore whether or not they would be eligible for insurance, either through the private network that's been established, or if they may be eligible for the expanded medical assistance coverage that Pennsylvania implemented earlier this year. We have certainly seen a great number of people that previously were not eligible for medical assistance who are now eligible for medical assistance. Anybody within that 138% of poverty may now qualify. So if you had somebody working with somebody previously that was on the cusp, we would certainly encourage them to reapply. And that's my presentation. I do have some handouts if you would like any of this information, or if you would like some information on community care behavioral health. I have a copy of their website and some of the information that they have available, and some information in terms of how to apply for medical assistance as well. So any questions for me? Yes.
I have a general question.
Okay.
Whether either of the presenters could talk about unmet need in the counties, and also to what extent can you provide Hispanic community, where there might be language problems?
Well, those are both great questions. Unmet need, at least through the Health Choices program, we are constantly looking at where we may want to expand services. Adams County is unique in many ways. Being as small as it is, we know that the needs are growing, and yet we also know that for some of our services, you have to have enough people that can come to it. For instance, partial hospitalization, we were exploring the need for a local partial hospitalization program in Adams County, and we're having a hard time having enough numbers to make that program work here for now, but it is something that we're keeping in mind moving forward. But I would say that at least through our department, we are constantly looking at maybe where we may want to expand. Right now, I would say a lot of our expansion is more looking at individual practitioners that can do some outpatient counseling, but we are always interested in information that anybody would have that helps support where you're seeing an unmet need. I do want to mention earlier that there was the one question about WellSpan, and one of the frustrations I think for us is that WellSpan is a huge provider and they do a lot for us, but we also do have other providers that are out there in the network. And so one of the things that we probably need to do a better job at is making sure that people are well aware of what other options are available to them as well, because certainly we want people to get the services in a timely fashion. In terms of your question with regard to bilingual services or meeting the needs of the Hispanic population, that is something that we are just currently right now actually focusing on with our managed care company. They are currently surveying to try and find out how many therapists we actually have in our network that are bilingual and able to meet that need. And we've asked them in conjunction with our support to try and look at expanding access to bilingual services. Certainly as a fallback, what all of our providers have is the opportunity to use interpreters, although we certainly recognize that the use of interpreters is far from the best option.
Well, in terms of meeting unmet needs, our program is extremely in a difficult situation and has been for years. Unlike the Health Choices program, which is a federal entitlement program, health insurance with behavioral health services. So if somebody has medical assistance and is eligible, all those services that Michelle outlined there have to be available for them, and MA pays for it. Our program, we are totally dependent on funding that comes from the state of Pennsylvania through the Department of Human Services. So we get an annual allocation from the state, X number of dollars, and then we have to try and meet as many needs within those allocated funds as we possibly can. So we are really subject to whatever our governor and legislation passes in a budget each year. Give you an example, a few years ago, the budget for MHIDD services was initially cut by 20%. It ended up being 10%. And for York and Adams County, that was a loss of almost $3 million worth of funding that we had to reduce various services. There is some budget information that's presently being negotiated between the governor's office and legislators that are going to begin to restore those budget cuts at a third each fiscal year over the next 3 years. But we never know each year how much we're going to get available. Most of the time, it's anywhere from no increase to a 1%, 2%, or 3% increase. It's hard to meet unmet needs with those types of increases. So our challenge is just try to make sure we can serve as many people in the community as we possibly can with what we get, and really rely on the Health Choices program and medical assistance to serve our most needy individuals, our most seriously persistent mentally ill individuals, because number one, they're going to be eligible, and number two, there's a steady funding stream available to them.
Since the question came up from the two ladies about the need for transportation for follow-up medical needs, if a nonprofit, and that's a hypothetical, if a nonprofit steps up for that, how do they have to be prepared to handle that kind of service?
Well, again, the problem we're faced with is our funds are not designated for transportation. We have allocated some money to Rapid Transit to transport people to and from the Art Center. But as you noticed, when I went over the various services, transportation was funded. The state doesn't give us money. Here's your transportation. There is a medical assistance funding that's available that pays for some transportation to mental health outpatient services, that sort of thing. But we're the wrong experts.
What capabilities does that provider have to have? I mean, as far as liabilities, what do they have to do to properly handle the people? I don't know if you have that background.
Well, again, my experience with that is with Rapid Transit, they certainly have staff who are trained to be able to transport people with multiple disabilities. I also would say most of our group home programs come equipped with the vehicles, so they do a lot of their own transport. For example, facilities that open up in Adams County, they'll have their own van. So people need to go to doctor's appointments, they're going to transport. They need to go grocery shopping, they're going to transport. So that does help. The general population in Adams County with the rural nature, it certainly is, hasn't been a problem.
When you mentioned about not having the numbers, I think we have the numbers in Adams County, but it's stigma against people with mental illness and people accepting the need.
Stigma is always a problem because yeah, you're right. Well, we know what we know, but we don't know what we don't know. And that is the problem. And that becomes hard for us to get our arms around who's actually not showing up at our door and gathering that information.
And I know I helped out in a nurse about the emergency room last night. We had 5 crisis patients in the emergency room. That's not
Michelle, as you know, I've long been a supporter of your programs. And, right now, I'm currently begin running to a number of therapists in my office building. And there's a lot of HIPAA requirements. I was wondering if you toured the proposed human services building, and I have concerns with the probation there and everything, meeting the HIPAA requirements for privacy for your patients and things like that. And has that been addressed? And I know you're familiar with those things.
Yeah, no, actually, the Health Choices Department, in terms of unmet need, is actually going to be a funder, a partial funder for this project. And actually, we very much support this. And coming from a human services center in Newark, I would say that there are extreme benefits in co-locating all of your human services providers together. I will say that that doesn't relieve you from having to have those pieces of confidentiality in place. I think the proposal here does allow for each department to have their own entranceway and their own offices, which we obviously would have to have. But actually, I think there is great benefit to having individuals together. A lot of the families that we end up serving, at least those with intensive needs, are often involved with multiple systems.
I want to comment on that too, because I think you raised a good point regarding the requirements. In York County, when the commissioners renovated what was eventually became just the Human Services Center. It started out with everything from domestic relations to MHIDD to children and youth and what have you. Now it's primarily all human services. As part of the renovation project, the HIPAA compliance officer for York County was involved in the development of the renovations so that each specific department was HIPAA compliant. For example, I have almost most of the basement.
and all the third floor in that particular building. And you can go through the whole, from all of our area, everything is HIPAA compliant, from locked files to a waiting room that's separate from back where our case managers are, to just signed HIPAA releases and things like that. Like if you walk into the doctor's office, everybody's had to sign the HIPAA form, so we have all that. I would anticipate that Adams County will have the same type of safeguards.
Oh. Yeah, we have a, possibly, can everybody hear me? Basically, it's a health insurance portability act, and the part that we're making, right, it covers a lot of different things, but when we, in our business, when we talk about the we're talking about protected health insurance, or health information, health information. So if you're a consumer of my program, you want to make sure that your information, which is your own private information, is not exposed to or can be seen by somebody that shouldn't be seen. And that's basically what it is. So our case management records, for example, all HIPAA protected. Now all of our case management records now are primarily on a web-based system. So you have to have a password to actually get in to see the files for some particular. Pardon? Well, that's where we rely on our IT people, and we expect that. No question about that.
We're running late here, so I would like to get our, as courtesy to our speakers, to get them on. I'm sure these folks will stay afterward to answer your questions, and this is great. Many times we always get good information. We don't get many questions. This may be the most questions that we were having for them, and that's wonderful, so thank you. At this time, Michelle, thank you, and they may have some questions for you afterward. Our next presenter is Jay Arnazak. He is the director of CJAB, Criminal Justice Advisory Board, which is an arm of the courts, which is a collaboration of many individuals and agencies who support the criminal justice system in Adams County. So, Jay, it's all yours.
In the interest of time, I'm going to be very, very, very brief. Fortunately, I work with the courts and they've taught me time management. So I'm going to go ahead and put this information up because I'm not going to hit everything in detail like I planned. First of all, my name is Jay Arnazak. I'm the Director of Resource Development with the Department of Operational Services of the court. And I've been in the county employment for over 27 years. I spent about 20 years in probation services. And one of my primary jobs right now is the coordinator of the Criminal Justice Advisory Board. You've heard that mentioned a couple times tonight. I had planned to talk a little bit about the Criminal Justice Advisory Board, because I'm sure there's plenty of people in the audience that aren't familiar, but what I would do at this point is invite you to the county website. There is some information about the Criminal Justice Advisory Board on the website. So I'd invite you to look at that, including our strategic plan, which mentions quite a few of the mental health initiatives that I was going to cover tonight. What the primary part of my talk was going to be on, it was the mental health subcommittee, which is within the framework of the Criminal Justice Advisory Board, and some of the good work that's been done on that since I took over as coordinator in 2008. The mental health subcommittee has worked on developing some protocol for law enforcement when they respond to mental health incidences, particularly severe mental health incidences in the county. We did that in 2009. We also have held 2 different mental health awareness trainings. Steve Warden helped to facilitate those. One was in 2009, one was in 2012. And that covered many of the law enforcement personnel in the county, as well as some of the courthouse personnel in probation in their departments. One of the programs that I was going to talk about in some detail is one that we're very proud of. It's a major project that we initiated in 2012. That was the crisis intervention training. It's a modified version of crisis intervention teams and the Memphis model that was started in Memphis, Tennessee. We modified it because of the size of our law enforcement population in the county, the resources that we have. But it provides mental health training to law enforcement personnel so that they can respond to mental health situations and help to try to divert these individuals away from the criminal justice system and into the mental health services that are available in the county. I want to briefly just hit some of the highlights of that program. It started, like I say, in 2012. It took a little bit of time for us to actually start up the program. But in 2014, we hired the first CIT coordinator, and he established some CIT trainings in the county for law enforcement, emergency services, and first responders in the early part of 2015. Currently, 25 individuals have been trained in the CIT curriculum. 2/3 of the 911 dispatchers have gone through special CIT training themselves, and approximately 6 individuals in the county have been trained to actually be CIT trainers here locally. So we have the benefit of having trainers for the program here in Adams County. There is another training that's in the process of being scheduled either for later this year or early 2016. And since the time that we got started here at the beginning of 2015, there have been approximately 46 data sheets submitted, 46 incidences that were responded to by the CIT program. Out of those, only 6 arrests were made, 1 warrant was issued, and 3 probation violations occurred. So it's also worth noting that only 2 incidences involved minor injuries to staff members. Thus, the program has seen some early results within the county, so we're very proud of that. One other thing that's happened here this year is Act 25 was recently passed by the state requiring more training on mental health issues by law enforcement and magisterial district justices. So this act should produce even more interest in the CIT trainings in the future. That was the main program that I was going to talk about. I was also going to have Dan Reck from Probation Services speak to 2 other programs, and I've been asking to do that briefly because I think it would be a benefit for people to hear. And that would be on the Forensic Mental Health Partnership and the Juvenile Jump Program, which are both related to mental health treatment within the courts.
Good evening, everybody. I've been with probation almost 21 years, and I thought that I really understood mental health. And a year and a half ago, I became director of the Specialized Probation Services, and Juvenile Services. And I really learned that I didn't know that much at all. So this is really helping me tonight to learn much more about what's going on. But I do want to talk about the Forensic Mental Health Partnership and the juvenile program called JUMP. First of all, though, I want to say that the courts in Adams County take the mental health issues very seriously and really support us in the treatment programs that we're running. The Forensic Mental Health Partnership is a program that I took over about a year and a half ago, and it is a collaboration with Adams County and MHIPD. We are looking at individuals who are in twofold. Some are in prison that have mental illness, and our main goal is to get those individuals out of prison as soon as possible into a group home or back into a home environment that is an approved home plan for them. We do not want to keep the mentally ill incarcerated. We also want to, let me just tell you real briefly about the team of people that is involved with the Forensic Mental Health Partnership. It's a mental health probation officer, myself as a director, and then we have an MHIPD caseworker or case manager. As a team, we work together to get these individuals hooked up with the right services, to get the right needs, and hopefully get them out of the system as soon as possible. I'm not going to talk much more about that because Steve really did a great job describing all of the services that I was going to mention. The other program is JUMP, the Juveniles United with Mental Health Professionals. This program in Adams County, I believe, has been around since 99 or 2000. Steve can probably tell me exactly, but it's pretty close to that. The main goal with juveniles, one of the things we want to tell you is when juveniles come before the court, many times the court isn't aware of all the problems that juveniles have. And we do a very intensive intake interview with juveniles. We also do administer a tool called the YLS assessment, which gives us the risks and needs of a juvenile. We prepare as much information as we can before this case goes into the court, so we can take a look at what risks and needs this juvenile has. If we discover that there are multiple issues and the juvenile has an Axis 1 diagnosis, then we can get a psychological evaluation on that child or a psychiatric evaluation on that child, which would prescribe then the JUMP program. It is a prescriptive program. Once the judge orders it, we have to have a prescription to get the services administered. We don't have specialty courts in Adams County, but this JUMP has what we call an informal JUMP hearing, where with the kids and families that are involved with this program, every 6 weeks, we bring the family and children before Judge Kuhn, very informally. There's no stenographer, there's no record being kept, but it just helps the judge understand what progress the child's making and to determine whether or not that child would go through to the next stage. There's 4 stages of JUMP, 8 weeks, 6 weeks, and 4 weeks. And at the end of the 24 weeks, the goal is to have the child released from probation. So if they successfully complete JUMP, at the end of that 24 weeks, the family should know, and if they don't, it's our own fault, they should know what community-based services they can access, they should know what health services they can access, and they can always call us if they need more information. I will also be around if you want more information, because I went through it pretty quickly. So that's all I have.
If you will indulge us for just 5 more minutes, I think we probably be best with the district attorney sitting in the audience, not getting the perspective of the district attorney's office, being the top law enforcement officer in the county. And I know from my law enforcement background, I mean prejudiced, but I've dealt with mental health issues all the time on the street. It was amazing. I could sit here and tell you stories all evening about the folks I ran into. So Sean, would you give us your perspective in about 5 minutes?
Very quick 5 minutes. Good evening, ladies and gentlemen. I think it's important, and I know everybody's talking about how long they've been involved in their various disciplines. I'm in my 29th year as a prosecutor. I've always been a prosecutor my whole life. And we've seen a huge change in how we look at different issues in the criminal justice system, be it drug and alcohol or be it mental health. And I think in Adams County, as we've seen some of the programs that have developed, and these programs have all developed over the last several years, we are taking a much closer look at those individuals that are in the criminal justice system. Why are they in the criminal justice system? And are there steps we can take to divert them so that either one, they're not in the justice system, or if they are we providing the proper services necessary so that they're not incarcerated, they're getting the help they need, and ultimately we won't see them in the criminal justice system anymore. And I think we're at a very exciting time in our future right now. We've heard reference to a human services building. The key here is access. It's going to be, we're going to have programs that are strictly in York County that are now going to be available in Adams County, especially dealing with mental health and with drug and alcohol issues. We are having 2 new judges, possibly 3 new judges here in this county next year. There are a lot of things that are coming together. And I think through all of these things coming together, we have a real opportunity here in the very near future to take a close look at what we've done. Most importantly, what can we do in the future to expand the services we already have, to ensure that that we are having the right people incarcerated, the right people in the criminal justice system, and those individuals that don't need to be in the criminal justice system, let's provide the services that they need in order for them to function and not have to deal with the issues that unfortunately the police see on a daily basis. I'm very proud of the CIT program that's out of the district attorney's office. I have a county detective that runs that program. My understanding, within the last year, there have been 56 contacts through CIT trained officers, and out of those, as you heard, there were 6 arrests. That means there were 50 cases that were diverted. Those were individuals that, because police officers had proper training, they recognized, realized that there was a mental health issue. They were able to, and the key word is here, de-escalate that situation, and that person then was not arrested and not put in the criminal justice system. I think that's a good example of where we're going to go in the future, and I think we have a great opportunity here in Adams County, starting here with all these services coming together, and with a lot of other things that are going to happen. So thank you. I hope I didn't go over 5 minutes.
All right, thank you, Sean. I'd like to thank all the presenters who came tonight, taking their very valuable time and coming to this session. I'd like to thank all you for your questions. Again, I don't think we've ever had that many questions in one session. I'd like to thank, again, the Cross Keys Village for their hospitality tonight. I see everyone. Well, Steve's here. There he is. See, everybody's still here. So you're certainly welcome to stay around for a few minutes and ask any questions you can have the opportunity to ask. And I thank you very much, and have a safe drive home.
Oh, thank you.
So you were typing. Thank you for 20 times.